Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In continuation with the Module 2 Regulation, Accreditation Measures and Standard Treatment Guidelines, we will be concentrating today on the chapter 19, that is Avedis Donabedian model of structure, process and outcome. Here we would be discussing about the entire model plus the indicators and how we have to use the indicators in the processes and interpreting the indicators. As said by Florence Nightingale, the ultimate goal is to manage quality, but you cannot manage it until you have a way to measure it, and you cannot measure it until you can monitor it. So there is an emphasis on monitoring, there is an emphasis on measurement, and there is an emphasis on managing the quality. There how you can see the vision of Florence Nightingale at that time. So people have known this general fact since late 80s, and the most famous person in nursing agreed with it, that was Florence Nightingale. She had a great vision towards quality, and you can count her along with Dr. Simon Willis, even Florence Nightingale, as one of the pioneers of quality. It is very important to collect clear facts in healthcare covering both patient care and business management areas. It is also key that people using healthcare services can quickly get to useful statistics and use them well. In the past, doctors and hospital managers used their personal thoughts, feelings, and what they heard from others to plan health action, and this was an usual way even being seen at many times. But what happens today? Today, in the professional world, like quality managers, doctors, nurses, who want to use proof-based methods, where they can gather the proof, they can just speak on that, and they can work with that, must rely on data and the lessons it teaches. We live in time ruled by information. Most of us know how a car dashboard works. It shows the important signs, telling the driver clearly if the car is running well and needs to be fixed something right away. The same idea works for a hospital or a clinic's dashboard. It shows signs about patient care and management, along with how these signs have changed over that period of time. So an hospital needs to have its own dashboard. This emphasis on the importance of dashboard. This helps leaders see if the building is working well or if a certain part of it needs to be improved. The good thing about using a dashboard, and why do we require dashboard? It shows important long-term facts in a way that it is easy to use. It is easy to even understand. It allows for a quick check of the whole organization condition. It helps out for the quickly look at a key performance number and find things that are going wrong. So it is very important just to see and mark it upon the dashboard. It lets you make choices based on those key numbers and problem spots. Having everything together helps you look at the data more closely. Therefore, it is the importance of data which can be reflected on the dashboard. It lets the organization focus on the information that is most useful, and that's where the organization can get more best out of it. By showing how changes can help, it makes it clear to get money to pay for improvements. And that's how you can say that you can invest in quality if you do work closely on the dashboard. There where comes now Avedis Donabedian. The Avedis Donabedian model of structure, process and outcome. Just to learn how to build a dashboard, to work on the dashboard, we can just see how the Avedis Donabedian model works for. To learn how to build a dashboard that checks and make clear better, we need a strong way to manage healthcare work. A trusted plan used across the world. Even it is in India that we can say the Avedis Donabedian model of structure, process and outcome is widely used. The Donabedian model is famous plan. It is a plan to check how good healthcare is. It was created late in 1966. It can show and it has enabling that healthcare organization to evaluate and to improve the quality of their services in a very systematic way. This is where the Donabedian model is there. The structure, process and outcome model is a trusted plan for monitoring and improving quality. You find the structure, that is the building, the staff and the equipment, where versus in the next line the processes that we can say it can be diagnosis, it can be treated, it can be prognosis, and the outcome may be like the health changes in a patient and patient satisfaction. You are expected actually to closely follow all this process of structure, process and outcome. The structure part, let me explain to you. This means everything that makes up the place where people get the care. So it is a place where the hospital tries to treat the patient. It covers the building, it covers the tools and the people who work there. It also includes the things like staff, teaching, and how people are paid. So entirely you can understand what a structure in a hospital or a healthcare is. So these things affect how staff and patient act, and they show the usual quality of care in a place. Structure is often simple to look at and measure. So here we are emphasizing on how to take care of the structure. In what way we need to measure the structure. So if the structure is poor, it can lead to a lot of problems and in later in the processes as well. So it means that the structure forming different small groups that manage the medical work. So the examples of structure is like hospital infrastructure, equipments in the hospitals, the staff's qualification, the training given to the staff, the organization policies, and the financial resources. These are all the examples of the structure. Now come with the processes part. What is a process? This refers to all the actions that are done in the healthcare. Means this is a action driven part. What are the common actions that we can see in the healthcare? The common actions are finding a sickness, treating the patient, stopping it from happening, or proceeding it, and even teaching the patient. So entirely this gamut is of process. It can also include actions like taken by the patients or their families. So you may find from sickness to the interaction and communication, which is all done with the patient along with everything that is happening related to the care, is called as process. The action of the process is split into two. That is, one is a technical, second is interpersonal. Technical is how the care is done and there are steps into it. The interpersonal action is like how the care is given, means like versus to how the care is done and how the care is given. The care is given in a way like talking, kindness, empathy, and so many of the things which counts itself into the interpersonal part. Where does Donabedian come now? Donabedian model said that checking the process is very close to checking the quality. So you need to emphasize on checking the process when you are seeing the organization as an hospital employee, as an quality manager, because the process includes every action of giving help. So you can find there is a help which is being asked when you are checking the process, and thereby you can understand the process. The facts about the process come from the patient's files, patient's information, talking to the staff and patients, or even watching visits. So this all can compromise actually to give you the process. What are the examples of process? Doctor-patient communication. The entire gamut of the process is the very first example. Then the medication administration protocols. So you need to see what are the protocols in your hospital, particularly to medication administration. And the very important part is infection control measures. What are the infection control measures which are existing? What are the infection control measures which are taken in your hospital? Then comes in a line what is the outcome. We saw the structure, we saw the process, and now it is the outcome. This covers all the results of the healthcare on the people. The entire outcome actually is derived on the results of all the structure and processes that were there in the healthcare. It means change in the health. We expect that there should be a change in the patient's health. We expect that how they act actually results into their health. So how they act is also the outcome. What they know actually of the organization. It can be employee, it can be the patient. So the outcome is more derived on these facts. It also includes if the patient is happy or how good their life feels due to health. So you can find the entire change being seen as an outcome. Outcomes are often seen as the best signs of quality. So if I have to emphasize and say that what are the best signs of quality, you should say it is outcomes. Because the main goal of the care is to make patient healthier. And that way we always try and discuss that there is always an emphasis which is given on what are the outcomes. People will ask you what are the outcomes. What are the outcomes to your patient? What is the outcome of your healthcare organization? What is the outcome of your hospital? But it is quite hard to correct a measure. That results only come from healthcare given and not from the life factors. So you should try to emphasize more on correctly the measures part. The examples of the outcome. It can be counted in the mortality rate, which is very disguising actually to a hospital or an healthcare institution. The patient satisfaction scores, if they are good, then it is a very good part for you. If it is poor, then it is something actually you need to work on, like doing an RCA, that is a root cause analysis, why the patient satisfaction score is less. Definitely it results to so many other things. Reduction in the disease complications, which is very difficult actually for the organization to cover when you find such a difficult outcome. Hospital readmission rate, which you cannot really come across to see, and hospital readmission rates shows there somewhere or the other there are problems in the process part, even in the infection control practices. So all these are very important examples actually to be seen as an indicator, particularly for the outcome part. What are indicators and why do we require indicators? As I said, indicators are the one thing actually with which you can visibly see your organization. You can measure the variables. You can work on those improving the indicators. An indicator is a measurement that reflects a given situation. That is what WHO has said. World Health Organization has emphasis on measurement that reflects in a given situation. In the Indian healthcare system, since the national quality check started with NQAS and NABH, there has been a big shift towards setting up ways for structure, setting up ways for processes to result in ensuring the quality. Therefore, the purpose of setting up an indicator at a national quality checks is to ensure quality. Instead of only looking at how healthy patient become, that is health outcomes. The idea of using indicator to check how well medical and business work is done hasn't become an important part. Therefore, we find that institutions are largely emphasizing on developing, improving, and making more indicators in their organizations. What is the reason of this? The reason of this is just to measure it. An indicator is a number-based measure. So it is more a numerical. That shows how well the jobs are done, how well the systems are, or the steps works as time passes. So there are many constraints where you can come across which can give us your value where you can improve. The improvement no doubt will be work with the help of the team. It should be seen as a culture in the organization where you need to improve the indicators. It is a way to track, judge, and make better the followings: how quick, how useful, what dependency, goodness, and complete the management. Even the medical and support systems also needs to be included. So all these systems affect the patient result. It is not that only with the one part that you can work on the patient results. The entire health outcome of the patient is derived mostly on all this part, like how you work quick on the part, how useful it is to the patient, what is the dependency, how good it is, how make it complete to the management, and what are your medical or clinical and your support systems. So the indicators can largely be split into two areas, that is clinical and managerial. Clinical is mostly related to patient care, where versus the managerial part is related to the business. So clinical indicators and managerial indicators. We will try to emphasize more by stating that how these clinical indicators really works as. Clinical indicators are derived from multiple areas in the organization. You may find that including the patient assessment, the patient care, even the care which is being taken with the help of the lab, where you may find an emphasis on the lab reports, the radiology safety measures, test around times, anesthesia indicators, infection control practices, which comes to give you infection control measures, medication management indicators, which are very important. The very important one is infection control practices, medication management indicators. Medication management indicators such as medication errors, stock outs, and etc. You can add surgical outcomes also and emergency response times, which makes a comprehensive of clinical indicators. Then comes next is managerial indicators. What are managerial indicators and why do we require business in healthcare? Managerial indicators covers aspects like patient satisfaction score, which is very important for any business improvement in healthcare. Employee satisfaction rate, which is very important part for the HR actually to work on when they need to improve this managerial indicators. Length of stay of the patient, which derives actually what is the business the hospital needs to work on, where if it is increasing, it is really following the wrong track. When it is decreasing, definitely it is improving the image of the hospital. Equipment downtime, which is very important for the revenue part actually, and to work on actually what are the delays that our system is coming with the help of the equipments. And most important is the utilization of critical areas. If you are able to make more best out of this, definitely you may find that you may get a good business. Defining and using indicators. How and in what way we can see that indicators can be bestly used in the healthcare. It is necessary to properly define the indicators. You may say numerator and denominator. You all must be well versed with these two terms, that is numerator and denominator, and decide if it will be count, ratio, percentage or rate per thousand. So you may say that is there a small level of statistical understanding that you need to derive or you need to work on this part, where your quality team can definitely take a help actually to understand what the statistics really come. Selecting an appropriate sample size is essential to ensure that the collection process and the final results are reliable and statistically valid, which is very important to state that when an indicator is being seen as a full-fledged and flourished, you may say that it is statistically valid. It has more reliability. Data collection must be thorough and with well-organized methods. The methods which comes with trends, types, sources and tools must be the same across all the nursing units. You cannot say that it is only with the one and not with the rest. What does it ensure? It ensures the standardization and the data quality, which gives more importance in developing a proper indicator. Data is typically collected using structure forms or automatically captured by advanced IT system. Nowadays, we can get an help of the IT system into the dashboards to work on the indicators, where you may find the refined indicators to measure comes and give you a more data set. The entire data that is being collected is then summarized to allow for meaningful interpretation. The meaningful interpretation allows actually the quality professionals or the hospital employee to assess the patient care quality. The quality which is being imbibed actually to give the patient care, and you can compare the results against the similar to the external hospital, where you may find that how you are able to achieve the benchmark. Sharing this data with the staff encourages the staff to focus on their ongoing quality improvement, where it is very important that you need to get a validity actually, or you need to see that how your staff really works on this data. In what way actually this data really helps them actually to improve, rather than not actually to count actually for their blame. Interpreting indicators, this is very important part where you need to emphasize with your quality team, your infection prevention control team, and all the committees which are working on improving the health outcomes. How to interpret the indicators? A very important and very useful question. To achieve lasting improvements, it's vital to first pinpoint the root cause of the variation in the indicators. What is the variation that you may find that the indicator has? The first step is to study the changes in the indicators. Sometimes you may find there are indicators actually which change over the trend, over the time. So, viewing these indicators as a trend which helps the hospital staff to determine if a data shift is common cause. May you say that the normal system changes or special cause variation. As in sometimes there is an unusual situation, even sometimes a specific problem, which may tend to show you that there is a special cause variation versus to the common cause, which you may find the normal system changes on an equipment or a process or an activity. So, where we can say interpreting indicators is more based on the value that is changed. Understanding the difference is critical because what is the corrective action required for each type is different. So, where you may find that many times there is some sort of challenges which needs to come up when you are trying to understand the difference. So, your quality team needs to work on the projects related to identifying, to improving, and to measure it. Committees must regularly view the indicators to analyze the trend and to examine the specific changes that need the deeper review. It needs a sort of an regular way of viewing it. Let me put up an example. A clinical example is the Infection Prevention Committee. The Infection Prevention Committee regularly reviewing the trends that is going on in the hospital with related to one of the issue that is called as healthcare associated pneumonia, which you may find as one of the major cause of the mortality, including antibiotic use and ventilation duration across all the units. So this may put up actually very important cause of identifying what is there to work on reducing the healthcare associated pneumonia, which is one among the biggest HAIs, healthcare associated infection. The second example is more from the managerial part, where the managerial indicator example is the quality council. The quality council is addressing increasing patient discharge delays. So most of the time the hospital are being seen that the discharge are too much of delayed. Even in Indian healthcare setups, this is one of the major reasons that the management is being blamed. What is the reason? Investigating reasons behind the trends will put you, and when you are evaluating the current solutions across the different department, you may find a lot of plan. The planning of the discharge is not done, the discharge team is not prepared, even the bills actually from the pharmacy versus actually the entire payment actually needs to be calculated. So many issues actually you may come across actually which may add how a discharge is being seen in terms of delay as a managerial indicator. You can find many specific indicators in the rules set up by NABH, where you can see in the latest edition you may find much and more improvement into that. JCI, the 4th edition, or in the latest version you may find much more specific indicators actually with respect to these rules. All systems that grant quality approval rely on constantly watching and checking these clinical and managerial indicators. The system in the hospital needs to work on developing and seeing the regular and updated checks for that part. Needed improvements are made to keep quality high, and this is where you may say that the improvement really works on. Therefore, it is the key to decide what will we measure, how will we watch or track it. The we comes from the entire team. The we comes from the entire hospital. How will we study and review what we track? Whatever we have seen, whatever we have measured, whatever we have tracked, how will we review? That is very, very important. Who will review the indicators? It is not a person actually who has not been skilled or who doesn't have any project experience or has not worked cannot review. So it is very important for the review the indicators you need to have an expert. How often this review happens, that is very important. When you do it regular basis or do in a monthly basis, it is very important that you can see into the high quality checks. How choices are made about what to do next, because even after completing all these 5 steps, the sixth step is very important. What will you do next? What happens actually that when you find something as a reason, what steps are being taken if action is needed? Many times the last process is one which gives you the major decision, like how your organization culture is much more evolving about the issues of quality. Then in the last, we can focus on what the entire chapter on Avedis Donabedian really focus on indicators and developing the dashboard. Collecting clear facts and number in terms of both patient care and management part of the healthcare is very crucial for quality and decision making, which is very important that when you find that this was the beginning of the modern nursing, where it was given importance on the cruciality of understanding the quality, and that helps actually to make a best decision. A hospital's dashboard, like a car's dashboard, shows you the key signs where it will be really being a problem, and it is allowing you to give a strategic choices and action. The trusted plan for monitoring and improving the quality is the Avedis Donabedian structure, process and outcome model, which looks at the setting first at structure, then the actions that is to being taken as a process, and the final results of the outcome. An indicator is a number based measure used to track how well your jobs are done, how well your system or your steps work over time, helping to make a delivery of a care quick, useful and dependable, which makes you to show that yes, that is a trust I can gain, that is the best outcome that I have already delivered. So indicators are separated into clinical types and managerial types depending upon clinical related to the patient treatment and safety, where versus the managerial types related to the business efficiency and patient satisfaction. All quality systems rely on constantly watching and checking these indicators and making changes based on the data they capture to keep up the quality high. Thereby we can say that you need to monitor, you need to check and you need to improve based on the data that you received for this indicator. Thereby you can say how the systems are improving. So these are few references where you can work on the existing or projecting your future projects for taking and developing the indicators in your organization. Thank you for the day.